Painkillers, blood thinners, and chemotherapy drugs are just some of the substances that are found in your drinking water. There's new information that some drugs are ending up in our water at levels never seen before. CBC's Kelly Crow has more on that.
There's something happening to the rainbow darter, a tiny fish that lives in the rivers of southern Ontario. If they're downstream from a sewage treatment plant, the male fish turn into females.
Pharmaceuticals are defined by Merriam-Webster as relating to a medicinal drug. They are taken by people every day to control various illnesses. Through human excretion and improper disposal of pharmaceuticals, they end up in our wastewater treatment plants. Wastewater treatment plants in the United States are not meant to separate out small particles like pharmaceuticals, and instead shift out larger particles according to the USGS. This means that trace levels of drugs end up in streams and can be absorbed into the groundwater, which is the main supply of drinking water. Trace amounts of drugs in the drinking water would only have a normal dose effect on humans after hundreds of glasses of water. Most of these drugs show up in concentrations of less than 10 nanograms per liter, with some examples being antidepressants, blood thinners, hormones, and painkillers, according to Harvard. But the real worry here is about affecting the aquatic life. Animals living in the water are seeing these effects of the pharmaceuticals, like the fish who changed their sex. This affects their reproduction and the overall health of the species.
The result of pharmaceuticals in water starts with the manufacturing of the pharmaceuticals. The doctors then prescribe and distribute patients medication for illnesses. Then, by improper disposal of expired medication, or by ingesting the medication, the pharmaceuticals end up in the wastewater. Through the treatment of that wastewater, the water is purified to drinking quality, but the pharmaceuticals remain in the water because they are considered a persistent chemical.
Here are some other ways that pharmaceuticals get into your drinking water that you might not think about. When people are treating a common headache or body ache, many people take more than the prescribed dose written on the bottle. This can lead to a higher concentration of drug in the wastewater. Also, residue from pharmaceutical production can release chemicals. Veterinary drug use can also release chemicals, especially antibiotics and steroids, as well as residue from hospitals. Also, human activity, including bathing, shaving, and swimming, can release topical medications, and illicit drug use is also another way.
So how do we fix this? Currently, even the most advanced water treatment methods, ozonation, photolysis, and ultrasound, only remove between 20 and 60% of the pharmaceutical byproducts. Also, it is a really expensive method and can increase the carbon footprint as well. In order to reduce the concentration of pharmaceutical drugs in water, human action can play a big role. Proper disposal of leftover or expired drugs is the main method. The FDA has been researching the effects of pharmaceutical drugs and provided a flush list of drugs that are safe for drinking water. There is also the option that some pharmacies have started a take-back program where you can return the drugs safely. The last option would be to dispose of the drugs in the regular trash with the labels scratched out for protection. Also, in some states, the state governments are trying to pass laws to make sure pharmaceutical companies are fundamental in helping dispose of unwanted and unused drugs. So let's make sure we dispose of drugs properly and take the prescribed amount so we can ensure the health and safety of the aquatic life.